As countries decide when the right time is to reopen their economies, the main factor preventing them from doing so is the idea that a second wave of coronavirus could hit their nation. This could overwhelm their healthcare system and potentially lead to another lockdown. So what is a so-called second wave, and how can countries protect themselves from it? To understand how deadly a second wave can be, we have to go back in time 100 years. It's March 1918, and a strange new disease is killing people in a US Army base in Kansas. Soon, the virus spreads throughout Europe and the world as World War I rages on. However, for most people, symptoms of a high fever and malaise last about 3 days, and the virus only has a mortality rate similar to that of the seasonal flu. Over the summer, reported cases of the Spanish flu dropped, and people hoped it had run its course. However, in late August 1918, a new, mutated strain of the virus started to spread. This could kill you within 1 day of getting symptoms. The mortality rate of the virus rocketed. In the month of October in the US alone, 195,000 people died from the disease. Millions more died within a short period. Historians and scientists today argue World War I was a major factor in spreading the disease, but also the lack of major public quarantines. By December, the second wave of the virus was over. But deaths would not stop there. The next year, a just as dangerous third wave would hit the world. Although millions still died in the third wave of the virus, with World War I over, the disease found it less easy to spread, meaning the virus was less deadly. The Spanish flu is thought to have killed between 20 and 50 million people worldwide. However, most of these people died in the second and third waves of the virus, not in the first. If a vaccine had been created in time, millions of people could have survived. With huge advances in modern science, a vaccine could potentially be ready for COVID-19 within 12 to 18 months. Until then, countries are likely to keep social distancing measures in place while slowly easing lockdown restrictions to allow their economies to continue. This would hopefully prevent any significant second wave of the virus. If nations decide to ease lockdown measures too quickly or too early, a deadly second wave of the virus could again overwhelm local health services, leading to tougher lockdown measures being re-established. World leaders are attempting to prevent a stop-start approach to their coronavirus response, as this may lead to even more harm to their economies. Therefore, the question many health experts are asking is, how can we avoid a deadly second wave of coronavirus?